what I just wanted to do was to say a little bit about what's been great about doing this, some of the things that we've done that I wouldn't have ever expected to do, and also to make sure that I thank everybody for what they've done for me, what they've done for Healthwatch. You'd be pleased to know, with about 60 people in the room, I'm not going to thank you individually. And there'd be an awful thing about trying to remember someone's name and forgetting it. But so if I don't mention you individually, you know, it doesn't mean I haven't appreciated individually what you've done for me. I was wondering whether to put some sort of tag to the talk, and I thought, well, as people know here about my love for cricket, whether I could look at titles of cricket autobiographies or something and find something that was suitable. But they all had a very sort of nostalgic looking at the past sort of view, and I didn't really think that was quite appropriate. So I wondered about other sports titles, and one of the things that people have said about us is punching above our weight, and there's lots of sporting biographies called Punching Above Your Weight, so we could have gone for that. But I wondered if it was partly about our independence, but also our collaborative ways of doing things. And so I looked to see whether there was anything about being independent and effective partnerships, but they were all very sort of self-help, how to build your own relationships and so on, so perhaps not quite appropriate. Okay, so I'll come back to titles later, but some things that have been great really have been one's been the opportunities to provide that feedback that people have provided us, patients have provided us, researchers has provided us to help improve services, and been very much encouraged to do that by health and care partners. So very, very rarely, if at all, have we not been listened to. People wanted to know what was happening, wanted to know how to improve things, and that's been great. It's been brilliant working in collaboration with so many great organisations, very dedicated, very compassionate organisations as well. It's obviously brilliant working with the staff team that we have, and I'll say a little bit more later, and also having a very strong supportive board, both through the last 10 years, but also now as well, which has helped me an awful lot, and the chairs that we've had all the way through from Sarah to me. It's been great being a CEO and being chief exec, which I never expected I ever would be, and I've loved it. It's been absolutely brilliant, and I think it's worked for me. So that's something. So if you're ever in that situation, about there's a chief exec opportunity and are you the right person, go for it. So it's brilliant. And you can just, you don't have to go to someone for everything, and you can develop your own policies and proceedings. It's brilliant. Go for it. One thing that's also been great, I think, is in a job I didn't necessarily expect as much intellectual rigor as it brings. So the stuff, say, around the research program, some of the stuff I've been involved with recently around research, it's like really stimulating and interesting, and it's a bit of a challenge. The old sort of grey cells still have to work a bit on that, so that's been good. I think as an organisation, we've had a focus on action, on improvement, and we've heard a lot about that today. But it's also an organisation, I think, that's very well run. The governance is very strong, and the governance and the operational stuff enable us to do what we want to do. So they provide that assurance, but they've also provided systems, models, approaches, which have enabled us to be an active organisation. Neil kindly said about values and behaviours, and they've been fundamental, I think, to us as an organisation, and working with the team that represents those, that embodies them all the time. And also, it's been really good, and again, I can look at Christy on this, about our independence being understood by partner organisations, and also by patients. So we are independent, and that is crucial in the sense that we can bring that objective perspective to things rather than being part of the NHS or part of social care. So some things that I didn't expect but have happened. So I wasn't necessarily sure we would punch above our weight, but we do. One of the nice ones was the chair of the CCG at the time saying, well, we're the bricks, the NHS and social care are the bricks, you are the mortar. I thought, that's quite good, isn't it? Well, they stick it all together. I didn't think we would have, I wouldn't have known we'd have had a research programme. I wouldn't have known that I'd ever been described as being entrepreneurial, if I like that, in bringing out that extra revenue. I wouldn't have necessarily expected a national impact of our work that Neil has talked about. For those people on the front row, there's the opportunity that we're having co-production as a default position within the NHS. Now, would we have expected that? I know there's a degree of cynicism whether it'll happen, but if we'd said, you know, in 2012, we would have had the equivalent of a CCG making a commitment to co-production as the default position in its way of working, or the way that the Mental Health Collaborative has done that, made that same commitment around co-production. It's pretty impressive. I didn't know our reputation would be so great. 130 people applying for a job with us. That's pretty impressive, isn't it? Nice. And of course, I didn't know we would be working virtually, that we'd be working in the way we are without an office. But that's also been beneficial in being able to have people across the country working for us and making a contribution that they did. So all those sort of opportunities that we've had, I said it's been my favourite job. I've loved it. I've also personally been able to speak on local, regional and national events. Again, I wouldn't have expected that. And I wouldn't, there seems to be something about whether I have gravitas, which is something I never thought I had. So that's been quite nice. It means I've chaired big meetings nationally and locally, and some sort of public consultation things. So that's been good. And I also was chosen by one of the 5 people to meet the leader of the opposition, not the current leader of the opposition, the leader of the opposition when they were visiting Hertfordshire, to give a feel of what the NHS and social care was like. That's pretty good to be asked to do that. That shows that we're seen as an important organisation. So thank yous. So thank you first of all to the patients who, and perhaps I'll use people, you're right, people, communities who've given their views to us, which has enabled us to be the organisation that's had that impact. And lots of people here, again, I won't name, but who represent groups of people supporting people who won't necessarily have their voices heard. And alongside those patients, I'll say about patient reps, who I've described as that sort of terrier-like in their determination for that patient voice to be heard. So thank you for what you've done. Thank you to NHS and social care staff, people that I've met, people who every day are working tirelessly to provide excellent services for people. So thank you for that. And thank you to VCFSE organisations for the sort of empathy and compassion and practical support that they provide on a daily basis to everyone. It's been brilliant working with them. I mentioned our board and chairs for their belief in us, allowing us to be the organisation that we are, and the leadership that they've given. And sometimes when things haven't quite gone to plan or something hasn't worked, board members have always been hugely supportive in that situation. So thank you in that way as well. But finally, I've got to thank the team. It's been an absolutely brilliant team over the years to work with. The commitment's been astonishing. The insight that they bring, the values and behaviours we've talked about, they've made Healthwatch the organisation that it is, where it's been a joy to work and to spend sort of 10 years of my working life. So the final thing is, if we go back to cricket books and cricket titles, one is an autobiography. It's called "It's Been a Lot of Fun," and I think that's been what it's been like for me. Thank you, everyone.